So the Human Epilepsy Project is a multi-center study done in the United States where we enrolled about 150 people with treatment-resistant focal epilepsy, and we tried to make them as similar as we could to the type of people who would be enrolled in randomized placebo-controlled trials of new therapies and new devices so that they would be sort of representative. And that means that they are having 4 seizures a month, that they've failed multiple anti-seizure medications. And we then took those individuals and we said, okay, what happens to them as we follow them prospectively, and it's an observational study, over time? Do they get better? Do they get worse? Or do they stay the same? And I think that a lot of people have the perspective that once somebody is treatment resistant, you can't help them or they don't get better. And we actually found that overall people do improve month on month on month in terms of their seizure frequency. We can't tell you yet whether that translates to an improvement in quality of life, but they definitely improved in terms of their seizure frequency. And we think that that's really important because there are several therapies that people have invoked that they might be disease modifying because people get better over time. And most of the studies that look at that, since our trials tend to be 3 months long and no longer, and then people go into a long-term extension and they're in the long-term extension for months to years, and you see a general improvement over time, and that is not disease modification. That now we know is what happens to people with treatment-resistant epilepsy when they're cared for well. So our only message here is that if you really want to look at disease modification, you have to look at a control group as well and see that your disease modification is on a different trajectory than the group as a whole.